tell you something you probably don't know about your kidneys. Your kidneys are working every single minute of your life, filtering your blood and getting rid of waste. But then there are certain things we do that can put them under serious stress, and this may be surprising to you. So let's talk about kidney failures, the causes, and how one can protect his or her kidney. So let's get started. But before we do, I would like us to understand what the kidneys are. And these are simply two organs that are located at the posterior part of the abdomen, just below the ribs. Now, these kidneys in question has several functions, which includes the filtration of blood to remove waste, removal of excess fluid and excess electrolytes from the body through urine, the production of hormones used in producing the red blood cells, and so on and so forth. Now, it is important to note that about 20 to 25% of the cardiac output at rest goes to the kidney. So this means that in every 1 minute of the heart pumping blood, that about 20 to 25% of this blood goes to the kidney. So let's move over to the main topic, which is the kidney failure. Now, what is kidney failure? Kidney failure simply means a condition that arises when this kidney loses almost most of its abilities to perform these essential activities. This is when it has lost its abilities to filter the blood and remove waste, when it has lost its ability to remove excess fluid, when it has lost its abilities to produce hormones for the production of red blood cell, and so on and so forth. And then there are causes of this kidney failure, which includes the AKI and the CKD. Talking about the AKI, this is the acute kidney injury, and this is when the kidney suddenly loses its function for over days or hours. And then in this case of kidney problem, it can actually be reversed depending on the cause and on the treatment. Then when you talk about the CKD is actually when the sudden failure of the kidney progresses for over years, and then it's which actually leads to the permanent failure of the kidney, and then this is where there will be need for dialysis, kidney transplant, and then so on and so forth. Now let's come back to AKI so we can understand it better. So just like I've said before, that AKI which is the acute kidney injury, is the sudden loss of the kidney functions over hours and days. And then there are causes of this AKI, and they are grouped into 3 categories. Here we have the pre-renal, we have the intrarenal, and then we have the post-renal. So talking about the pre-renal, anything renal has to do with the kidney. So, and pre is before. So this is more like before kidney damage. Like this is a damage that occurs even before it gets to the kidney, right? So here we have severe dehydration, severe blood loss, and then low BP. So talking about severe dehydration, what are the cases, what are the conditions that can make someone be severely dehydrated? Now we have something like excessive sweating, severe fever, repeated vomiting, not taking enough fluid during sickness, and then a significant fluid loss to bones. This is in cases of burns where the victim must have lost some certain amount of fluid. Now let's talk about severe blood loss. Now what are these causes of severe blood loss? Here we have something like complications during surgery, we have obstetric blood loss, we have trauma, and then so on and so forth. Now coming over to low blood pressure, what are the possibly causes of low blood pressure? Here we have severe infection, we have shock, we have severe dehydration, and so on and so forth. So when this all of these are possible, what it does is that it will lead to the less circulation of blood in the body, which is the general circulation of blood. Which would in turn also lead to the less circulation of blood getting to the kidney. And then because this kidney is not getting enough blood, it will get affected, and then it will begins to deteriorate. Now let's move over to the intrinsic or the intrarenal damages. Here we have the direct damage to the kidney tissues. So in this case, there might actually be enough blood getting to the kidney, right? But the kidney tissue is damaged, and then we have possible causes such as certain medications. There are certain medications which, when taken inappropriately or taken in excess, causes damages to the kidney tissues. We have medications such as antibiotics. We have NSAIDs such as the ibuprofen, piroxicam, diclofenac, and then we have some antibiotics such as the ceftriaxone, vancomycin, gentamicin, azithromycin, and etc. All of this medication, if when taken in excess, especially if you as a person is already at risk of having kidney failure or is already dehydrated, it might lead to the increased risk of having this kidney failure. Then another thing under this intrarenal damage is what we call herbal mixture. So that is the concoction we all know about. So because this herbal mixture is natural, it doesn't mean it is safe for your kidney, because there are some certain problems it can amount to, especially because we do not know the dosage of what we are taking, we do not know the ingredients, and then some of the substances can actually cause direct damage to the kidney tissues, and then most of the substances in most cases can actually interact. So in as much as you are being deceived or told that it is good for your health, please stop taking it. It is not good. Now let's move forward to talking about diabetes as another cause of intrinsic AKI. Just like we all know that diabetes is a condition that occurs when the blood sugar level in the bloodstream it's high. So in cases of AKI, what really happens here is that when this blood sugar level remains high for over a long period of time, it would actually destroy the vessels supplying to the kidney, and would also destroy the filtration structures of the kidney, which is the nephron. And then because of this destruction of the filtration structure, what then happens is that it will cause the albumin, which is also the protein which is supposed to be in the blood, to start leaking into the urine, and then this is known as a diabetic kidney disease. And then I must also add that diabetes is one of the leading cause of kidney failure. So if you are at risk of this kidney failure already, that is if you already have this diabetes, please, I would advise that you go for a regular checkup for your kidneys, because most times in the early stages of kidney failure, most individuals do not manifest with any symptoms. So please do go for a regular checkup. Now let's talk about high blood pressure as another cause of an intrinsic or intrarenal AKI, cause of AKI. Now talking about the high blood pressure, which can also cause to less circulation of blood to the kidney, will affect the kidney in some way that diabetes does. So I would also urge you that as someone with high blood pressure, please be on a regular check and then monitor your blood pressure. Now let's talk about smoking and alcohol also as a cause of AKI, intrinsic AKI. So talking about smoking, what smoking does is that it will actually cause a vasoconstriction, that is, it will cause a narrowing of the blood vessels supplying to the kidney, and in return it will reduce the lumen, that is the opening of that blood vessel. It will reduce them, that is constricting them to a certain amount, to a certain level, that it will actually lead to low amounts of blood getting to the kidney. Now talking about excessive use of alcohol over time, what it does is that it will actually suppress the antidiuretic hormone, which is the ADH, and this antidiuretic hormone is the hormone that helps our body to hold on to water. So what it does is that it will actually suppress this hormone, and then it will cause the individual involved to start urinating frequently, more often and on. And then when this person starts micturating frequently, it will actually cause dehydration, especially if this fluid are not being replaced. So we also have something called the infections, which is the sepsis. When there is severe sepsis, it can lead to general systemic illness, which can affect to how blood reaches to the kidney. Now let's talk about the post-renal damages to the kidney, that is the post-renal causes of AKI. Here we have something called the obstruction of the UTI. This is when the urine cannot efficiently leave the bladder. This is when the body cannot expel the urine in a proper way. And what happens here is that I've heard most people saying that holding your urine for a very long time can actually cause kidney failure. But then you are not completely wrong. What happened in this case is that when you hold your urine for so long, right? If at all we can remember the structures of the urinary system, here we have the kidney, the ureter, the bladder, the urethra, and then from the urethra to outside. And I remember that this urine is formed by the kidneys. Then from the kidneys it gets down to the ureter, bladder, and then it's being stored for whenever someone feels pressed. So what happened here is that when there is a chronic urine retention, that is when this urine has been stored in this bladder for a longer period of time, consistently, not just once, not just like if it is more like a frequent something you have developed doing, and then like what happens is that because of the constant retention here, what happened is that the pressure in the bladder will get high, and because of this increase in the pressure, it will cause this urine to flow back. That is, instead of going down, instead of from the bladder, it goes to the urethra, and then from outside, what it will happen is that it will flow back from this bladder up to the urethra, then back to the kidney, especially when the opening connecting the urethra and the kidney is not properly working. It will now cause a backflow into the kidney, and this is when it causes a problem to the kidney, and this is when it leads to a condition known as the vesicoureteral reflux, which is the FUV. Now we are done with the causes of the AKI.